Good evening, everyone. Today we will look at something that is very important for the NCLEX exam. We will be looking at lab values, their ranges, and how to read them. So we'll start with sodium. Sodium ranges from 135 to 145. If it's less than 120 is critical. If it's more than 160 is also critical. Something needs to be done. So if sodium is less than 135, it's called fluid volume overload. When there is an overload, we don't want to give salt, we don't want to give free water, because when the sodium level in the blood is too low, it causes water to go into the body cells, causing them to swell. So this swell can be dangerous, especially for the brain. It will trigger symptoms such as confusion, irritability, seizure. Just just know this seizure thing, and coma or even gait imbalances. When sodium is above 145 is fluid volume deficit. So this patient is dehydrated and we need to rehydrate them. So if a question comes up and says something like a patient presents to the emergency with fluid volume overload, what will you do? You want to initiate seizure precautions because this person might go into seizure. So I saw somebody wrote, can we give someone who is dehydrated free water? We can give them, but why will you give them free water? How long will it take it to circulate? Why don't you give IV fluid? I will say IV fluid anytime and every time. Another one is hematocrit. The changes behave just like sodium. So when hematocrit is high, it's fluid volume deficit. When it's low, is fluid volume overload. But one thing is HCT has ranges, different ranges for male and female. So female ranges 37 to 47% and male is 42 to 52%. So what I tell people in my class, and this is true for new people, when I was studying, instead of trying to memorize these different ranges for different genders, what I did was to memorize the least and the highest. So if I were the one doing these studies, instead of saying 37 to 47 for female, 42 to 52 for male, I will say HCT is 37 to 52%. So I will take the least and take the maximum, knowing that they will not give me anyone that is so close to either of them. But if you can memorize them separately, by all means do it. I really don't. So I put them in brackets. So another important one is potassium. Potassium ranges from 3.5 to 5. If potassium is less than 3 or more than 6, it's actually a problem. Either way potassium goes, for the fact that the potassium range is not normal, it's a problem. So the changes in potassium is related to muscle and dysarrhythmias. So if someone's potassium is low, you want to put heart monitor immediately. Somebody said, can you explain how potassium is related to muscle and dysarrhythmias? So what I meant was, if you have a question in exam that says someone potassium level is not normal, so even if it's less than 3.5 or more than 5, once the range is not normal and you have options related to anything muscle, maybe muscle pain or dysarrhythmias, that would be your option. Another lab that is important is blood sugar. So blood sugar is from 70 to 110. If it's less than 70, it's really bad. We want to give them juice or 15 grams of carb, recheck their blood sugar in 15 minutes. If it's still low, we should give them another 15 grams. So we'll do 15, 15, 15. So when I was studying, I actually read it and was gonna memorize it. I am not really good in memorizing, I rather understand. But each time I memorize these 15 carbohydrates, like adding something to it, I will forget it. Well, I remember I have to give them juice, I have to give carb, So I decided to just memorize the 15, 15, 15. And to be very honest, on the day it matters the most, just the 15, 15 thing I memorized saved me. So if the blood sugar is high, it means poor control of diabetes or that the patient is on steroid. So if they are giving you questions and they say the blood sugar is high, above the range, check on the question if the person is on steroid, so you don't just rush to pick an answer and end up picking the wrong option. In addition to blood sugar, you have HbA1c. Is done over 3 months. Guys, over 3 months. So you don't go for your exam and they say the HbA1c done over 1 week. No, if it's not 3 months, it's not correct. So HbA1c is done over 3 months. And if it's greater than 7, they are managing the diabetes poorly. We want it to be less than 7 over 3 months, remember. Then we have the WBC, the